Hi, Dr. John with Pro Chiropractic, and today we're talking about shin splints and what kind of treatments that we offer here at Pro Chiropractic. Shin splints can be a really aggravating type of injury, and maybe you've been told, hey, stretch your calves, do some ABCs, and just ice them at home, and that hasn't been getting you where you want to be. So let's look at a couple of the treatments that we offer here at Pro Chiropractic. Now, the first thing that we like to do is ultrasound. Ultrasound therapy is a deep heating modality. So through this wand, electrical current actually vibrates a little piezoelectric crystal. There's actually a crystal right in the end of this. And that sends heat deep into those areas that are inflamed and irritated. Now, typically the ultrasound treatment is going to cover an area about this big, and it's going to take about 7 minutes for that ultrasound to do what it needs to do. So we'll just demonstrate. A little gel is put on the skin. Ultrasound can actually also be done underwater. It is not so easy to do it underwater in the office, so we use this conducting gel. But you'd move right along the area that's inflamed, moving slow circles. You always want to keep the ultrasound wand moving. So this is a great ancillary modality to help with shin splints. Now, once we're done with the ultrasound, again, that would take about 7-8 minutes in the office. We use another modality called Graston Technique. Okay, Graston Technique is also known as instrument-assisted soft tissue mobilization. All right, I know that's a mouthful, but with the Graston Technique, we use a metal instrument. This instrument has an edge, but it's not sharp. It's not going to cut or injure the patient, but what it does is it does a really good job of getting in and finding the areas that are gritty and have old injury, inflammation, or scar tissue in those. So we go right along the tibialis posterior muscle here, and what happens with shin splints is as your foot is going down to hit the ground, this muscle has to lengthen and contract at the same time. It's called an eccentric contraction, and it gets overused and irritated, so Graston Technique is fantastic for releasing that. Now, it's a little bit tender when we do that, especially when your shins are inflamed, so home icing helps with some of that, and the more you do with the Graston Technique, the better. Now, already you can see a little bit of red and blood flow in there, and we will get in there pretty good. And the Graston Technique, again, depending on what we're treating, there's actually a little bit of irritation right here. Depending on what we're treating, probably takes anywhere from 3 to about 10 minutes, depending on how big of an area that we're treating as well. Certainly with the Graston, we can go clear into the arch of the foot, following the course of the tendon of the muscle, or clear up into the area where the shin splints are. And then finally, as part of our treatment, we like to send the patient home with something that's going to assist them the rest of the time that they're not in the office. That's where kinesiology taping comes in. So for shin splints, we're going to use Kinesio Tape, and this is going to do two things. It's going to open up the spaces between the layers. We have layers of skin, we have a small layer of fat, we have layers of fascia. And so for this, you're going to work right into the course of that tibialis muscle, anchoring the tape down. Go ahead and flex your foot just like that. And we're going to follow right up the course where that irritates across, putting no tension into the end of the tape. Now, Kinesio Tape has a heat-activated adhesive, so natural body heat's going to activate it, but a little friction rub helps it hold on. And then what we do is put what we call ligament correction strips, I'm just going to turn you out here just a little bit, over the area that's most inflamed. So, for instance, if she told me that it's tender all along here, but really hurts right here, we're going to anchor right over this, park the tape on, and then we're going to put a little more tension on these to try to displace some of that force. Again, little friction rub to get that going. Good. The tape stays on anywhere from 3 to 5 days, even in the shower and everything. Important to tape at least a half hour before any athletic event. If you tape somebody that's already sweating or already warmed up, the tape's going to peel right off no matter how good the tape is. So, as a review, you come in with shin splint pain, ultrasound therapy, Graston Technique, and Kinesio taping, and then the doctor will give you some advice for home care like ice massaging and certain type of foam rolling or stretching that's going to be really helpful. Dr. John with Pro Chiropractic. Click on the link below to go to our website, learn about more videos. Thanks a lot.